Now let's jump to Texas, which reported 129 COVID-related deaths yesterday, the state's largest one-day death toll so far. The number of new cases topped the 10,000 mark on the same day, and Houston is now getting help from teams of doctors and nurses sent by the U.S. Army and by New York State. Janet Shamlian spoke to a young ICU nurse recovering from COVID and a doctor who compares the outbreak there to a war zone.
How heartbreaking is this for you?
Oh my God, man. I tell you, I was a flight surgeon in the Iraq War, but it's very different when the person that you're putting in a body bag is your next door neighbor for 50 years, your mom's best friend.
Dr. Ivan Melendez paints a picture of a healthcare system in chaos as beds fill up.
Things are so dire that people are being resuscitated on stretchers in the hallways. The night before last, I had 4 calls of 4 patients dying.
The governor says patients under 30 are a driving force behind the latest surge in cases.
It's really important to take every symptom very seriously because I could have ended up in a very bad condition.
24-year-old Houston intensive care nurse Heather Valentine came down with COVID and was just released from the hospital this week. She was lucky enough to have a room with a window where her parents could visit. Unable to touch, they pressed hands against the glass.
How frightened were your parents?
My mom, this has been her worst nightmare since, I'm on the front lines and I work with, people with COVID. She's been, so scared for me.
It's become a very personal and unfortunate experience.
Dr. Melendez, who also recovered from COVID, says emotions run high for patients, their loved ones, and the doctors and nurses on the front lines.
I think you can imagine that all of us cry every day. Every day they cry and they're angry.
Dr. Melendez says that 6 nurses that he's worked with have died of COVID. And he says at his hospital, they're doing the best they can right now to make more beds available for those coronavirus patients. Gail, a very sad situation down there in the valley.
I'll say, Janet, the doctor, I think, really puts it in perspective when he says it's very different when you have to put your next door neighbor, your best friend's mom, in a body bag. I don't know what it's going to take for people to understand how serious this is. Thank you very much.